This internship changed my views on my perspective on the medical field. I now understand like the rigor that the doctors have to take and how hard it is, and all the opportunities that are offered. And along with like all the hardships and challenges, like I also understand like the rewards that come after.
It allowed me the opportunity to be able to realize the things that I have taken for granted within the doctor's offices and everything.
It changed my views on the way the medical field works, and a lot of things that like the doctors do that I didn't know about really just helped me see a better insight on everything.
It was very great having people that have told me millions of times that if I need anything, I can always come back to them and ask them anything that I need help on.
If this program didn't exist, I wouldn't have the opportunity to see healthcare really that much. I would only see it, in the media or on TV, and also just to see minorities getting out there and doing healthcare and being in that image in a positive way.
I am most grateful for being chosen to be an intern with the Minority Medical Mentoring Program because I was able to get so much exposure. So ultimately, I'm grateful for just being chosen.
It allowed me to see a different sight into the medical field, and it allowed me to see like how each profession plays a role in the patient's life, if it's a CNA or a medical assistant or a physician assistant or the doctor itself. So that's
it was very great having people that have told me millions of times that if I need anything, I can always come back to them and ask them anything that I need help on.
I at first wanted to become a PA and specialize in diabetic management or physical therapy, but now I've realized that after going through several different rotations, it may not be the best fit for me, and that's okay. That's what this program is all about, exposing me to different areas of the health career and just getting to know what I'll want to.
I was most surprised by the doctors and how humble they were and just cool and just like real, like normal people, I guess you could say, because you don't really see them as normal. You just see them in a doctor's office and they're very informative. So I think that's right, okay.
Invigorating. This internship was invigorating because every single day after my school day ended, I'd be excited to see what other preceptor I was going to meet, what different practice I was going to see.
With this program, I really had to take on that task of always being on time. One of Miss Jacqueline's sayings that really has stuck with me is that if you are on time, you're late, and if you're late, then it's just unacceptable, but if you're early, then you're on time. So that really stuck with me since day one, and I've been trying to really take that seriously and do the best of my ability to always be on time, and just managing my time, being responsible, knowing that it's on me, that if anything else happens or if I am just not behaving, which is unlikely, it's all on me. So it just taught me a lot about self-responsibility.
I was most surprised by how willing and open all of the patients were to have a student intern in there shadowing their doctors and their providers, and they were so supportive of my experience and making sure that I got something out of being with them that day.
I was most intrigued with the way the doctors treated the patients and getting to see the patient interaction, and the way they were so personable with each and every patient. That was really intriguing for me, just to see how each doctor was different with each patient. So.
What I found most surprising about this internship was, I was able to hear stories with some patients. I was in a couple clinics where I did not imagine just looking at somebody and just being able to see and for them to give me and tell me their story, and having that and understanding, and for them to open up so much to a student, especially a really young student, 18-year-old, and that was really heartwarming to me.
I was most surprised by the cancer center rotations that I had because I thought they were going to be like really sad and mopey, but they were actually like really bright and the total opposite.
They all truly inspired me because they were all so knowledgeable and so supportive. But if I had to narrow it down, I would have to pick two of my top favorites. I would choose Miss Deborah Gorham and I would choose Dr. Bernstein. Miss Gorham, she made sure that every second I was really learning something, and every time she was with her patients, you could see her kindness and her understanding of the patients radiating off of her. So because of that, she was really inspiring to me. And Dr. Bernstein, like Miss Gorham, was always making sure that I was learning something at all moments. And she went out of her way to help me and my fellow interns with our group project that we'll be presenting soon. So I feel like they both have qualities that I want to strengthen and establish in myself as I enter the health field.
One of the preceptors that inspired me the most is definitely Dr. Bernstein. I saw the interaction she had with her patients, and, how kind and loving she was and how she treated everybody equally, and that was really inspiring to me as a student, being able to see that. And I got the chance to interact with her on a personal level as well and got to meet her son, and that was amazing.
Dr. Mastriani from Trauma Services at Mission. She works in the emergency OR. She's an OR surgeon, and she really took the time to talk to me one-on-one and treated me as a young adult and not as some other kid that was like a liability at that clinic.
Definitely Dr. Bernstein. She was there to help me in any way that I needed. I knew that. And she answered any questions when I had anything that I was curious on. She even helped me on a project outside of the internship. And she allowed me to open my mind more about just going into emergency medicine.
The preceptor I loved was Dr. Bernstein. She is so humble and down to earth, and she really makes sure she's taking care of the whole patient, and she really cares. She always gives them their phone number, and that's something I noticed that was definitely like her specialty or something she did that I didn't see in a lot of other doctors. Even though she wasn't on call, she would always give them their number and say, hey, like, you can call me if you have questions or if you need anything, like, please, call.
Dr. Doris from, I think it was Forest Dermatology. He's a dermatologist, and he was really heartfelt, and not only did he talk to me about his job, he talked about my college and gave me research and everything on like history, and it was fun being with him for a week.
I would have to say Deborah Gorham or Dr. Bernstein. More Dr. Bernstein because she's an internalist and she's kind of like doing what I want to do, but instead she's doing it with elderly people. And so she inspired me the most probably because of the way she interacts with her patients. She's so fun and just so much fun to be around, and the way she treats her patients are like she really cares about them, and that's how I want to be with my patients.
I definitely want to work in the medical field. I don't know exactly what, hopefully still emergency medicine, but we'll see how it goes from here.
I've gone through different rotations with trauma services at Mission, to physical therapists, and it's been great and all, but I've really just discovered my passion for journalism, and possibly maybe in the future I'll pursue medical journalism since I love talking about healthcare, and writing is a passion of mine, so I'm hoping I'll be able to do that later on in college.
I recently shadowed ABC Pediatrics, and I had so much fun getting to play with the kids and seeing the little babies. It was just a lot of fun just being with them and just having that patient interaction with them because they're not like adults and they're more happier, and so I just really enjoyed that.
Before the internship, I thought I wanted to be an OB, and now that I've shadowed, I know that's what I want to do. I love it. I think it's the most amazing thing ever, and so I'm really just excited to get out there and just start doing it and start working toward it.
Now, More than ever, I know that I want to go into the public health field. I know that I want to give back to my community by preventing illness and preventing disease, and I want to do that in the public health field.
Now I understand how hard it is, but I am also very enthusiastic to see what the future brings, and I'm up for the challenge to become an optometrist one day, and I'm up for it.
I want to be a labor and delivery nurse because of the rotations that I have had. One of them, I was able to see what I actually wanted to do before, which was a pediatric oncologist, and I just couldn't do it. I couldn't, it saddened me, so I chose the labor and delivery nurse.
I just want to say thank you to Dr. Mastriani.
Thank you, Dr. Bernstein, for this experience.
Thank you, Dr. Bernstein.
Thank you, Ms. Gorham.
Thank you, Dr. Bernstein.
Thank you so much, Dr. Bernstein.
Dr. Bernstein, thank you so much for everything you've done for me.
Thank you, Dr. Doris, for the opportunity that you gave me.
For inspiring us to become doctors and any healthcare professional.
For really taking your time and allowing me to shadow you for that day.
And helping me learn more about internal medicine.
I want to thank you for the knowledge and experiences that you have given me.
You really changed my views on a lot of things in the medical field, and you allowed me to see a lot of different patient interactions, and thank you so much.
It was amazing being able to walk around the hospital and be able to shadow you, and it was amazing seeing all the things how you treated your patients and the interactions you had with them.
You're just very inspirational to me because you inspire me to definitely go on and persevere in everything that I do, and I really appreciated your help throughout the internship.
For always making sure that I was learning, and thank you for being so passionate about what you do and showing me how parenteral anesthesia is a big part of healthcare.
I really appreciate it, and I just want to let you know how much it means to me that someone took time out of their busy schedule to really sit down and talk to me and teach me a lot of the different terminology and scenarios that I would have never been exposed to and would have probably never learned about or really understood in depth if I hadn't gone over them with you. And I just really want to appreciate you for that.
Good evening. I'm Jacqueline Hallam, Director of Health Careers and Diversity Education for MAHEC, and also the Program Director of the Minority Medical Mentoring Program. I'm sorry I'm not able to be with you this evening. I had surgery, and I'm currently in the hospital, but I wanted to participate in the program.
And I'm Frank Casablanco. I'm Director of Regional Services here at MAHEC, and thank you for coming tonight. And I'm a member of the MMMP Steering Committee, and I do believe it's a lifetime appointment because
Indeed it
I
is.
have accepted that. And I apologize because I'm not able to be there tonight as well. And both of us wanted to give you this message because we think it's a very important one to convey to you.
The Hope Banquet started several years ago as an initiative by the Ashford-Buncombe Institute for Parity Achievement in order to further support these students by using the Dr. Charles Blair Scholarship Fund. Dr. Blair served this community very well, and the Western Carolina Medical Society initiated a fund that is housed there to collect all donations and gifts for students via the Charles Blair Scholarship Fund.
I personally received a scholarship very similar to the scholarships that we're awarding tonight. And it enabled me to go to college, it enabled me to be a nurse, and today I have a doctorate in nursing. And so I know that it can mean a big difference in a student's life.
And I would like to ask you to dig deep and to make a contribution to the program. No amount is too small. Everything or anything that you can do will be appreciated.
You're making history. These students are actually getting out of medical school now, and we have proof that it does work, and you can be part of that. So please help us to help them and support their school efforts. And so what we're asking for you tonight is to be that difference in these students' lives.
You have 7 wonderful students that are here tonight that have benefited immensely from this program. So we're asking you to help us grow it,
Fund it.
and sustain it.
Thank you.
Good night.